My name is Neri Rodriguez. And I am a public health intern at the Maxwell and Eleanor Blum Patient and Family Learning Center at the Mass General Hospital. Before we get started, I would like to go over a few things. Please note that this session is being recorded for educational purposes. If you are interested in viewing this recording, it will be available on the Blum Center website at massgeneral.org/Blum-Center. Please note that everyone in this is in listen-only mode. Everyone has been muted so that we can hear our guest speaker. If you have any questions for our guest speaker, please use the chat feature at the bottom of your screen. We will have time at the end of the session for them. Only Blum Center and staff and the guest speaker will see your questions. Please don't share any personal medical information or questions in the chat. If you have any medical questions, please ask your doctor. Next, I would like to introduce you to today's guest speaker, Dr. Amy Newhouse. Dr. Amy Newhouse is an internist and psychiatrist at Massachusetts General Hospital and on faculty at Harvard Medical School. She provides interdisciplinary care between the departments of medicine and psychiatry. She is the program director for the Behavioral Neurology and Neuropsychiatry Fellowship and part of the leadership team for the Henry and Allison McCanns Center for Brain Health. In recognition of Brain Awareness Week, which was last week, she joins us today to give a talk on brain health. Please join in and welcome Dr. Newhouse.
Thank you so much, Neri. That was great. Hi, everybody. It's a pleasure to be here. I'm just going to set up my screen to share some slides with you all. And there with me. All right. So, Neri, that was a wonderful introduction. And again, thank you for this invitation. So my name is Amy Newhouse. I'm here today on behalf of the Henry and Allison McCanns Center for Brain Health. And as she mentioned, this comes just a day later of Brain Awareness Week, but I think that we can make do. And the title of my talk today is Brain Health for Disease Prevention. I'd really like to thank you all for the opportunity to give this talk and look forward to going through the slides and also having some time for some Q&A at the end. I should note we're going to have a few audience poll questions as we go to make this a little bit more interactive, and all of the answers will be anonymous, but hopefully that will facilitate a bit more of an interaction here since we're all on a virtual platform. So moving forward, I wanted to just share with you all a little bit of my medical journey thus far and hopefully help outline how I got here today and some of the twists and turns along the way. So I went to medical school in Columbia, which is in New York City. And there, when I was rotating through the various different clinical settings, I noticed when I was on my internal medicine wards that often there was a lot of psychiatric comorbidity that was perhaps not addressed. And then similarly, when I was on the psychiatric wards, I noticed that there was a lot of regular medicine that was perhaps pushed off until a potential later time. And so when I was trying to decide what training path to take, I did some exploration into this interface and actually found that there were some programs that existed that really focused on the overlap of internal medicine and psychiatry. And that brought me down to Duke, where I did my residency training. It was a combined internal medicine and psychiatry program, which was really wonderful. And I stayed, after finishing, I stayed down there for a couple of years as under a role called a med psych hospitalist. And I rotated similarly in a variety of different settings, all either inpatient medicine or inpatient psychiatry. And specifically, we had a service that was called a med psych service. And a lot of the folks that ended up on this service also ended up having neurologic comorbidities as well. And so to get some additional training, I pursued a fellowship in behavioral neurology and neuropsychiatry, which has brought me down from Duke in North Carolina up to Boston, where I am now at MGH. And that was a really wonderful opportunity and something that has then led to an even better opportunity to be able to lead that program now. And I've stayed on up here and I work in a variety of settings including inpatient medicine, but also a variety of psychiatric clinics, including neuropsychiatry and psych clinics. And the whole umbrella idea being that to be able to provide care that is interdisciplinary and able to help individuals that may have multiple things that are going on. And so as you've probably heard, as I'm telling you about some of my trajectory, a lot of my focus was really on multiple diseases that could occur at the same time. So about a year ago, when I got approached by the McCanns Center about this opportunity to join them, it really sounded A, interesting, but B, required me to think through a paradigm shift, because shifting from focusing on multiple diseases at a time to sort of all the way at the beginning, how do we help prevent them from occurring in the first place, was definitely a shift. And so over the course of the past year, I've had the opportunity to learn a lot, to be involved with clinics and research, and lots of teachings and lectures along the way that help facilitate that. And I'm hopeful that today I'll be able to share some of that with you. So it's likely, I'm just gonna spread this a little. Oh, my apologies. So it's likely that you know somebody that's been impacted by a brain disease or a disorder. These are very common. And this slide is meant to just kind of show you guys just how frequent it can be. So in 2017, 2.9 million people in the US had Alzheimer's disease or a related form of dementia. That translates into 1 in 10 people over the age of 65 that could have dementia. And it's projected that by the year 2060, that 9.3 million people likely will, if we stay on the same course. Taking a side step over from dementia, every 4 minutes, someone dies of a stroke in the US. And then taking one other side step further, it's an estimated that 21 million adults in the US have had at least one major depressive episode in the year of 2020, and that about 30% of US adults experience an anxiety disorder at some point in their lives. So the main point being here is that these are common. And the current state of clinical care is different depending on sort of what disease we're talking about or what organ we're dealing with. I think most of you have probably encountered before some general screening or attention under the realms of either heart health or cancer prevention. So for example, when people go to their primary care doctor and their blood pressure is checked or their cholesterol is checked, a lot of that is really geared towards risk modification to decrease the risk of, say, having a heart attack or something in the future. And similarly, there are schedules that are outlined for mammograms, for colonoscopies, for a variety of different cancer screening to be able to catch it either early or to hopefully catch it even before it even begins. And despite this, and at the same time, brain diseases being very common, the concept of brain disease prevention and mechanisms to screen for it really aren't commonplace in clinical practice at this stage. So now we're going to have our first audience question. I really would like as many of you guys to participate as possible. The question is, have you ever had a brain care screening at a primary care visit? The choices are yes or no. These are completely anonymous, and I would just love to see, if any of you have had this so far.
We'll give it a few more seconds for folks to enter their response. Okay, entering the poll.
Wonderful. Okay, great. All right. Well, thanks to all of you who participated. So as we can see here, the majority have not had any brain care screening at a primary care visit. And so that's what we're trying to work on here at the McCanns Center. We're trying to address this gap in today's typical care, because as we reviewed, brain disease is common. It's unfortunately impacting many, many people. And it doesn't just have an impact on the individual themselves that suffers from the brain disease, but it has, a detrimental effect on the family around them, the community around them. And then this also translates into having an economic impact on both the health system and the country and the world as a whole. So this presents an opportunity, right? If we know it's there, how can we potentially help kind of move the needle a little bit earlier on? And before we get too far into how we could potentially do that, I want to share with you these three faces here. These are the McCanns Center founding co-directors, and just tell you a little bit about them. So Jonathan Rosend is a professor of neurology at Harvard. He is an associate member of the Broad Institute and also serves as chair on the National Institute of Neurologic Disorders and Stroke Training Programs. He's really a leader in this field, a scientist, a clinician, and an educator, and is really a key force in driving this revolution about shifting how we approach this issue, really, and from brain disease treatment to brain care. Rudy Tanzi is also a professor of neurology at Harvard Medical School, serves as the vice chair to the Department of Neurology here at MGH, is the director of Genetics and Aging Research Unit, and is also the co-director of the Mass General Institute for Neurodegenerative Disease, and is co-author of over 600 papers and some New York best-selling books, so something you might want to check out. Greg Friccione is the Associate Chief of Psychiatry here at MGH. He's also the director of the Mind-Body Medicine Program, and has worked with former president on many issues surrounding public and community health work. And so the way that the McCanns Center thinks about how we might approach brain care is sort of in three different buckets: indicators, intervention, and integration. So what do I mean by indicators? Those are different things that might put someone at higher or lower risk, that might be a part of their medical profile, that are specific to them. And then interventions are the things that one can do once a profile has been established that can help either protect one's brain health, restore it if anything has been affected so far, and promote really behaviors and change. Integration takes it out of just the individual encounter and brings it into the system. How do we help change the healthcare system? How do we help educate other providers such that this becomes commonplace and it's not just a few of you that have maybe had screening when you visited a primary care office? And we recognize that in addition to the individual one-on-one, this needs to be taken in the context of the social determinants of health, because these things impact brain health as well. And these include access to healthcare, economic stability, education, language, the neighborhood one comes for, in the social context. And we're working to try and help fit this in wherever people are. And so sometimes it can be helpful to think about patients in three different groups. These are just outlined here in green, yellow, and red. The green being those that don't have any known brain disease, are perhaps low risk of developing any, but are still interested in preserving and promoting their brain health and preventing any disease that can happen later in life. Those in the yellow are considered to be at higher risk for disease. They might be someone that had a certain brain disease like dementia or stroke in their family. They might have some risk factors, perhaps like high blood pressure or high cholesterol, or they might have had something that have happened in the past that they're recovering from and they really don't want it to happen again. Those in the red are those that have active disease or brain injury. And while this isn't the main focus of the group, we recognize that a lot of these same practices that I'm going to outline later in the talk still apply even if disease has already started. So let's take another little turn to try and understand a little bit better about what brain disease really is. And to do so, we need to think about not just how things can go wrong, but how they can go right. What is the brain doing and how do we help take care of it? So our brains demand a lot of us. Even just at rest, they require 20% of our total body's energy. It really is the control tower of everything that we do, both consciously and unconsciously. Our brains control our movement. They also regulate our temperature, whether we need food, whether we need water. It integrates all the different sensations that we take almost automatically, those being our vision, our hearing, our sense of touch, our smell, our taste, and they integrate all of this information, and that can then help guide our thoughts and our behaviors and our emotions. And much of this is happening under the surface, if you will. We just kind of do it and we take it for granted sometimes, but it really is quite a complex set of interactions that our brain is doing just on a day-to-day, moment-to-moment basis. And so when we think about brain disease, one useful way I think to think about this is that damage to the structure of the brain can then lead to damage of the function of the brain. And so when I say structure, I'm talking about loss of or damage to neurons, which are the type of cells that make up most of our brain, but it also can be in reference to blood vessel inflammation or blockage, because of course we need blood to supply oxygen to the different parts of our brain. And hormone imbalance, since it controls a lot of our regulatory systems, if this gets out of balance, then that can lead to damage to structure in the brain as well. And the structural damage then can lead to functional damage. And so what do I mean by functional damage? That can manifest as impaired thinking, poor memory, trouble with movement, also depression or anxiety. And so what are some common brain diseases? And we've touched on some of these in the statistics slide, but I just want to take a couple minutes to review them again. We've got dementia, stroke, depression, and anxiety. And this isn't all inclusive, but these are definitely some of the highlights that many of us are probably going to encounter in some way in our life. So dementia is actually an umbrella term for problems with memory, thinking, and reasoning. It can present such as people losing track of things, forgetfulness, trouble with language, trouble with problem solving, some disorientation as to where people are or what day or time it is. There can sometimes be some changes in personality, changes in mood or behavior, and that can progress to the point of having difficulty with even some simple tasks. And we all can have some of these to some degree. We can have an off day, we can, lose track of things, but when it really becomes a problem is once it's progressed to the point of interfering with one's ability to function independently. And this, of course, can then lead to a loss of sense of self or purpose in the individual, but it can be heartbreaking for loved ones along the way. And often when people hear the term dementia, they automatically think about Alzheimer's, but Alzheimer's is only one type of dementia. It is the most common, but it's only one type. And I just wanted to spend a couple minutes just sort of outlining what some of the other kinds are and how the presentation might be slightly different and how they arise. So Alzheimer's typically starts with a gradual impairment in memory and progresses to more difficulty with thinking and reasoning over time. And it's due to an abnormal buildup of proteins that leads to neuron loss in the brain. Another common, though not as common, type of dementia is vascular dementia. And while this can involve trouble with memory, it may start less in the category of memory and maybe start with more difficulty in the realms of problem solving, focus, or have some slowed thinking. And this is caused by damage to blood vessels that over time leads to neuron damage. A third type is Parkinson's, which is also called Lewy body dementia. And that may start with a tremor or motor symptoms, or it might not. It might start out with visual hallucinations or changes in sleep disturbance or behavior, and similarly can progress over time to have a functional impact. This is also due to an abnormal protein buildup in the brain that can lead to neuron loss, but it's a different type of protein than what occurs with Alzheimer's. Frontotemporal dementia is not as common, but if it does occur, can show as changes in behavior or personality in addition to reasoning and thinking, and sometimes even in language. And this one affects a different part of the brain than Alzheimer's or Parkinson's classically, and deals with breakdown of the neurons that's in the frontal or the temporal regions. So Now let's switch gears for a second. We've touched on dementia, which is one type of brain disease. Now we're going to talk about stroke for a moment. This is caused by damage to the brain as a result of abnormal blood flow. And there are two main different ways that can lead to abnormal blood flow. One being obstruction to a blood vessel, meaning that there is a clot or a plaque that blocks it and stops the blood from flowing through. Another is a rupture or a bleed. And these are referenced here as both ischemic and hemorrhagic stroke. Both of them can lead to damage to the neurons, which can have a functional impact down the line. And so while this isn't a talk on stroke as a whole, and there's certainly a lot that can be discussed about this, I just wanted to take a moment to review some of the main signs, since it helps us all to know in case we encounter it in the community. So there's the acronym FAST, which stands for F is for face, if there's an uneven smile or a facial droop. A is for arm, but it doesn't have to just be arm weakness. It can be, leg or arm, one side of the body over the other. Speech is in reference to slurred speech. And the T is the emphasis on time. Time is, of course, not a symptom, but time is very important here, because if you were to notice this occurring, it's super important to call 911 right away, because time really matters in terms of getting a treatment. And now moving on from stroke and talking about depression and anxiety, as these are other forms of brain disease. They often go hand in hand, but let's just take these in two different buckets for a moment. Depression is marked by sadness, by lack of interest in activities. It can include disrupted sleep, poor concentration, changes in appetite, and then it can even progress to the point of feeling suicidal. Anxiety involves more worry or panic attacks, but can also lead to disrupted sleep or trouble concentrating. And as I mentioned, these can often go hand in hand. Now, we're all going to experience sometimes where we feel low, where we feel worried. It's when these symptoms become to the point that they're impairing daily life functioning that they count as a disorder. So now we're going to go to another audience question. Do you know anyone, including yourself, who suffers from a brain disease? And we're going to give it just a couple minutes. And again, these are all anonymous. And I appreciate your participation.
Give it a couple more seconds.
Okay.
Closing the poll.
All right. So as you guys can probably see here, the majority of you said yes, that you do know somebody. All right. And so that's really what I wanted to reiterate here, is that these diseases are very common, going from dementia to stroke to depression and anxiety. Pretty much all of us are gonna either know someone or have a family member or have something impacted ourselves. I showed you all this slide before, but I just wanted to reiterate just how common all of these are. So towards that, let's bring it into the context of other clinical settings again for a moment. Why would we wait for a heart attack to start treating our cholesterol? Or why would we wait until colon cancer has progressed to initiate screening? We wouldn't. And of course, it took time for the medical field to develop the tools to be able to screen, to develop effective interventions. And we're at a point now where we can really bring brain disease into that same realm. And we would argue, why should brain disease be any different? Why should we wait until symptoms are there, which might reflect, a long, months or years of damage before we do anything, if we can do something ahead of time to help preserve brain health? So here's another audience question. These won't always be so frequent, but do you think it's possible to prevent brain disease?
Okay, give folks a few more seconds. Who's gonna poll?
Oh, wonderful. I'm so glad to see that the majority of you have said yes. Whether that's in relation to this talk or not, you guys are ahead of the game. I think that a lot of people assume that it's something that might just happen to them and they hope it doesn't, but it absolutely can be. So let's talk a little bit more about that. Can brain disease be prevented? Of course, not everything can be prevented. So I'm not here to say that we can just erase these diseases from our society. However, there is a large amount of room that can be done. There's a lot of progress that I think can happen. So up to 40% of dementias can be delayed or prevented, and up to 50% of strokes are preventable, and up to 38% of major depressive episodes can also be prevented. And given the statistics that I showed you before, this is a lot of people, this is a lot of suffering that potentially could be saved. And so what can one do to prevent brain disease and promote brain health? Now that we've reviewed that it's common, it's preventable, how do we do it? Where can we go from here? So there are several different ways to think about it. As I've mentioned already, one of our goals is to help bring even just the concept of brain health and brain disease prevention into more routine care. And this comes through education episodes like this, where we get to talk ideally face-to-face with the community, but it also involves us going to offices, doctors, nurses, clinicians, and educating them as well. And ideally, this should be done from two sides. So one is a holistic approach to think about all of the different factors that can influence brain health, but then to take all those different factors and consolidate them into a personalized care, to recognize that one size is not going to fit everybody, that once we've established what are all the factors that are relevant for this individual person in front of us, how do we help that person maximize their brain health? And so towards that, we have developed this McCanns Brain Care Score, which is a multidimensional care tracker that is evidence-based, supported by science, and that educates and empowers anyone who interacts with it to take better care of their brain. And as you can see here on the right, and I realize it's a little small and we're going to break this down, but there are three main sections. There's the physical section, the lifestyle section, and then the social and emotional section. And we're going to take all of these in pieces. So let's start with the physical section. This involves several different categories that includes blood pressure, blood sugar, cholesterol, and BMI, which stands for body mass index. And all of these things, while often addressed in primary care visits as they currently exist, are very relevant for brain health and brain disease prevention. And that's the part that isn't always brought up so much. I don't know if you guys can see some of the details here, but it breaks it down into different blood pressure settings, what one's hemoglobin A1C is, which is a reference to an average blood sugar over the last 3 months, the different cholesterol guidelines, and then one's BMI. So moving on from the physical, we've got the lifestyle section. And that involves several different subcategories that are listed here. Those include nutrition, alcohol, smoking, exercise, and sleep. And while I can say those pretty fast, these are all really pretty big categories on their own. One number doesn't just give us the answer, but what people do in terms of their choices and their habits and their strengths and their limitations, all of these are relevant in terms of brain health. And so the last section, last but not least, is the social and emotional section. And this is really meant to put a focus on the impact of stress in the brain. It asks, what is the overall level of stress? But it also asks about what are the quality of the social relationships in your life? And does one feel as though their life has a sense of meaning? And so taking this all together, this can be a really powerful tool to start the conversation, either just with yourself or with your family or with your doctor, and then to think through what are the areas that I need improvement on, what are the areas that are going to be harder or easier to change, and then how do I start that process? And it really can promote taking an active role in your own brain care. And I should add the QR code on the top right here. If you scan it, will bring you right to a link where it is on our website. It's a free tool. Feel free to interact with it on the website or download it and print it and bring it into your doctor's office. And so in addition to the tool, which gives some guidelines about sort of recommendations for whether it be blood pressure or stress level or amount of exercise per week, I wanted to take a moment to talk about the SHIELD plan, which also gives some pretty sound advice about how to take better care of your brain. This was designed by Dr. Tansey, who was one of the co-founders of the McCanns Center, and addresses many of the same concepts, but with a slightly different spin as to how you can take care of your brain. So the S stands for sleep, with a recommendation being to get 7 to 8 hours per night if possible, because sleep really serves as a way to help basically kind of filter through the brain and clear away some of the abnormal proteins that can potentially build up and lead to cognitive decline. The H stands for handling stress. And it's been shown time and time again by this point that establishing meditation practices and mindfulness, tools that allow for one's stress level to be brought down a couple notches, can really have a benefit in terms of preventing cognitive decline or any of the other depression, anxiety, and stroke. The I stands for interaction with friends, because it's been shown that loneliness can actually double the risk of developing Alzheimer's. The E stands for exercise, as exercise has been shown to promote nerve cell growth in the brain, and not just nerve cell growth, but also to strengthen the connections between the nerves in the brain. And then this can help reduce the breakdown of, or promote the breakdown or reduce the buildup of abnormal proteins called amyloid, which build up in Alzheimer's disease. L is for learning new things. Using your brain, the whole use it or lose it approach, is really relevant because learning new things can strengthen and increase the number of synapses in the brain as well. And D is for diet. And this isn't meant to be diet in the terms of weight loss way, but in terms of thinking about the nutrition that we put into our body and how it can help fuel our bodies, but also our brain. This specific plan recommends the Mediterranean diet, but there are other ones that are out there if you're interested, such as the MIND diet, which really outline a good breakdown of fruits and vegetables and healthy proteins that can help promote brain health. And so I would like to put out the invitation that if you're interested, the McCanns Center for Brain Health has a clinic that does brain assessments. And this slide is meant to outline a potential journey that one might find themselves on. You might decide to download and print out the McCanns brain care score, and then bring it into your primary care office. That might serve as initial baseline screening, and that might lead to some baseline data that's being collected. And if you're interested, you can either ask for a referral or call in for yourself and perhaps come into our clinic to get an evaluation. Again, looking at the indicators and the interventions, right? So assessing what might potential risk be, what is your family history, what symptoms might you have so far, how are your other medical conditions being controlled, or maybe is there room for improvement? A next step might be to consider getting further brain imaging, maybe getting some further blood tests to take a look at what are some of your risk factors or your biomarkers, or maybe even to get a sleep study and get a sense as to are you getting healthy, good sleep that's helping clear your brain. Depending on all of these things, and if there are clinical trials that are going on, it might lead to a referral if you're interested to research studies, but it's not necessary. And then over time, there'll be longitudinal patient monitoring to see kind of how you're doing, what's getting better, what's getting harder, how can we help, or how do we transition back to your primary care. And so if you are interested, we have a website. This is the link. You can always call this number or also scan the QR code, and we'd be happy to answer any questions that might come. And so I do have one more poll before we go into the Q&A, and I have some additional slides if anyone is interested. But before we go there, I would like to ask you all, are you motivated to take better care of your brain?
Give it a few more seconds for folks to enter their response. Closing the poll.
Oh, wonderful. Well, you guys just made my day. Thank you so much. 100% of you saying yes. It really has been a pleasure giving this talk. I know we have a good chunk of time left, but hopefully I can help field some questions, or if we were in person, it would be more of a live chat, but I appreciate, you know, the virtual world that we live in now. So thank you again for this opportunity. And should I pull from the chat, or Neri, do you want to control this? Or?
I could do this. Thank you so much, Dr. Newhouse, for your presentation. Now we are towards the end of our session, so if you have any questions for Dr. Newhouse, please enter them in the chat box. Our first question from the audience is, can older people who use medication that has depression as a side effect, such as heart pills, PPIs, and so on, have a cognitive problem that affects their brain health?
Yeah, so I think that's a great question, because more broadly speaking, before I kind of attempt to go into details, is that it's always a balance, right? So we have to think about what are the potential cardiac risks that are there and weigh it against what are the potential side effects of the medicine. And this is where getting more nuanced with your doctor, I think, is really important. And so I would say this, you know, obviously not knowing the details of the person that put the question out, but I would absolutely bring it up. Again, there's a little bit of a difference between depression as sort of a symptom of feeling a little bit low versus depression as a disorder that's progressed to the point of being very functionally impairing. And so often things like some of the blood pressure medicine, some others can maybe lead to people feeling, they might say, a bit blah or a bit low. And that in itself doesn't typically have as much detrimental impact on the brain as, say, having multiple major depressive disorders over time, if that were to go untreated. So, the way that I would approach this is I would talk with your provider about, what are my cardiac risks? How do I balance that versus what are the side effects that I'm now experiencing of my medications? And I would go from there. But I think it's a wonderful question that outlines some of the nuances of this.
Thank you. Our next question is, how can older adults lower their risk of depression induced by these medications?
Yeah, so let's say, for example, that the medications are deemed to be very necessary in terms of protecting your heart or other diseases that are going on. Some things that can be really beneficial are our exercise, our mindfulness, our meditation, our increasing social interactions, our thinking about what really brings joy and meaning in your life, and really practicing it. I think sometimes often people feel as though they kind of need to wait for a good mood or good things to kind of come their way. But like anything, we get better at what we do. And so the more we practice joy in activities that cultivate joy, then the better we get at it and the easier they can come.
Thank you. And our next question is, how can you collaborate with your doctor to decrease the adverse effects of depression that may appear to be a cognitive issue?
Yeah, I would start really just by bringing it up, you know, and if there are specific cognitive concerns, because of course we all have different cognitive domains. They can be memory, they can be attention, it can be language, it can be complex problem solving. So helping to either think through and articulate which realms, or if you don't know, just say, I feel like my brain isn't quite working as well. Can I maybe get a more in-depth cognitive assessment to understand better? And then see what, if any, of the medications are driving it, and what can we do about it, whether that's change a medicine, whether that's add something else, whether that's prioritize a different type of behavior or a certain type of nutrition. There are certainly options that are out there.
Our next question is, if someone already has signs of Alzheimer's disease or dementia, is there any way to arrest the progression?
Yeah, so that's a great question. And the short answer is yes. So that, you know, and this is where when we're kind of thinking about green, yellow, red, right? Sort of depending on where people are in the potential progression of disease, you can almost always have some positive impact, whether it's really by whether exercise, following good nutrition, getting good sleep. I have really seen wonders with folks if they really focus on their sleep, that so many aspects of their cognition can improve even if there's a known disease that's already started. So absolutely, whether it's just symptoms of a disease or a diagnosis, all of these things still count and can have benefit and can slow progression over time. There are some medicines that are out there that I'm sure some of you guys have heard about along the way in news, and they can be helpful as well. That wasn't quite the focus of this talk, but there are things that you should absolutely discuss about with your doctor, whether it's you know, donepezil or rivastigmine, and those can have impact as well.
Thank you. Our next question is, what do you recommend for people to do when they are facing an anxiety attack? It usually feels like an uncomfortable sensation in the middle of my chest and a feeling of my head growing.
Yeah. Yeah, I know panic attacks are so hard, and they're really scary, you know, in the moment, especially if they feel like they come out of the blue. So different things work for different people. There are some approaches, usually kind of a first step would be to try, if you can, to kind of notice when it's starting to come, right? So if we think about something going from 0 to 60 really fast, which often panic attacks can feel like, starting to try and notice what's happening at 10 or 20, so you can maybe interrupt it a little bit earlier. And some strategies can be deep breathing, which you've probably heard before, but specifically, I find if you can take slow, deep breaths where you're counting to 3, maybe 4, and really pushing your belly out. That might sound silly, but a belly breathing approach that really helps push your belly out, push your diaphragm down, and fill your lungs with air. And that can help kind of settle things and turn it. Some other strategies that people can do are to maybe hold ice cubes in their hand, which can help shift the sympathetic fight or flight response over into the relaxation parasympathetic response. And then I would think about what your individual things are that help calm you down. You know, are you someone that going out on a walk helps, or maybe, you know, having a sip of tea, something that can feel soothing, that you can help kind of, you know, shift that moment of panic that you're in. But it's a great question. A lot of different things are out there, and tailoring it to what helps you best, I think, is most appropriate. These are great questions, by the way. I got to say, you guys are covering a lot of ground. I do know there's a question up there for the QR code to be shown again. Neri, is it okay if I share my screen again to put that on?
Yeah, you can share your screen.
Okay.
And while we wait, if there are any additional questions, are there any final thoughts that you'd like to share, Dr. Newhouse?
I don't think I have any other thoughts other than I just wanted to really thank you all for coming here, for kind of being brave and considering sort of a different paradigm shift, because this isn't something that's always talked about. And we absolutely welcome you to our clinic, but by no means do you have to do this in the context of our clinic. This can be done wherever you are, either on your own, with your family, with your friends, or you know, with your healthcare provider that hopefully you already trust. All right.
Since we don't see any other questions, that concludes today's session. Thank you everyone for joining us. And thank you so much, Dr. Newhouse, for the wonderful presentation. I hope everyone has a wonderful day.
All right. Thank you all. Nice to meet you.